Hi, I'd like to talk with you about depression and sexuality. When someone is depressed, there's an imbalance of neurotransmitters in their brain, which affects other areas of life, such as sexuality. This can be especially difficult for depressed individuals with partners, as their partners are then also directly affected. So sexuality should not be ignored when treating depression. However, it is essential to remember that treatment of depression should come before addressing any sexual concerns. Focusing on sex alone can traumatize individuals or make them feel worthless as human beings because they are trivialized to their physical capabilities to please others. Additionally, victims of sexual abuse or violence are more likely to experience serious depression. Social workers need to be aware of the background of their client and make sure their depression is being addressed before focusing on anything else. Depression can decrease self-esteem and body image. People who are depressed have thought about themselves negatively for so long, it can be hard to unlearn the habit of thinking about themselves in that way. They need to unlearn these thoughts in order to fully enjoy sexual relationships again. 70% of depressed individuals have sexual dysfunction. More women than men are affected, and both sexes have effects such as difficulties becoming aroused and the inability to achieve orgasm. These difficulties can lead to anxiety, especially in men who develop erectile dysfunctions. And this anxiety can cause a cycle of depression, dysfunction, and anxiety, which keeps circling. Depression also makes it hard to anticipate pleasure, which is essential in sexual relationships. Individuals who are depressed may experience a lack of energy or may not notice their partner's interest, which also decreases function. Medications also decrease sexual desire. They create delayed or absent orgasms and can cause erectile dysfunctions in men. Sometimes people stop their medical treatments because of these side effects, which continues the cycle of depression and dysfunction. People who are especially worried about the sexual side effects of their depression medications can talk to their doctor about changing the dose or the medication to something that won't affect them as much. Depressed individuals often feel that they lack social support. According to the social justice model, support at community level from partners, families, and other sources are essential to individual well-being. Addressing the sexual issues that often occur with depression can increase perceived social support, which would help treat both the depression and the sexual side effects. There are other forms of intimacy other than sex between partners. Sharing experiences and ideas and showing how much partners really care about each other is essential to maintain intimacy. Depressed individuals can be especially vulnerable, and partners should be careful to not hurt their partners physically or emotionally, either accidentally or on purpose. Sex can be important in relationships, but is not the only aspect. Remind clients to be patient with each other and be open to new thoughts and feelings regarding their relationship.